Good evening. We are going to look at a topical route of drug administration. Topical route of drug administration is used for the administration of drug on the body surface. This is the administration of drug on the body surface or on the skin. The drug applied topically are in form of lotions, creams, sprays, suppositories, ointment, paste, dusting powder. Topical routes include the following: skin medication, vaginal medication, ear medication, eye medication, rectal medication. Skin medication. Skin medication are applied on the skin basically for local effect. Application of drug on the skin for local effect. These are applied to cure skin diseases. Example of this medication include antifungal cream or ointment, example Nixoderm. Fumbac A, an antibacterial, example penicillin ointment. Chloramphenicol. Some of these come in form of dusting powder, example medicated powder. Others are applied in form of suspension, example calamine lotion for the treatment of chickenpox. The nursing responsibility of skin medication. 1. Application of the skin medication should be done after bath to free the skin of any debris or dirt. Check the procedure for the application before applying. Advantages of skin medication. The onset of action is sporadic on the skin. Thus, absorption of the medication on the skin surface is sporadic. It is good for patients who cannot tolerate oral drug. Example, patient that vomits. Another advantage is it is less painful, unlike intramuscular or intravenous route. Application of drug on the skin is less painful. Fourth advantage, it can be applied by patient himself or herself, even without the intervention of the nurse. Unlike the IV or IM routes. Disadvantages of skin medication. It is only effective for the treatment of superficial layer. It treats only superficial layer of the skin. Unlike IV, IM, and oral that can cure systemic infection. Skin medication can be washed by sweat, body fluid, or even when exposed to rain or any moisture. After application of skin medication, if the patient is exposed to rain or sweat can wash it away or rain can wash it away. Some ointment or iodine, gentle violet, when applied on wound, may cause pain and irritation. The next one is vaginal medication. The drug administered into the vagina. These are usually given at bedtime. That is, after application, the patient can be on the bed or apply when the patient is lying on the bed to avoid the drug from falling off when the patient stand up. Rectal medication are drugs in form of inserts, tablet, liquid that are passed into the rectum at body temperature. Example of suppositories like indomethacin, anusol, chlorpromazine. Example of liquid rectal medications include enemas. Advantages of rectal medication. Rectal medication have advantages and disadvantages. The advantages: one, this route is suitable for patients that have nausea and vomiting. It is suitable for patients that have nausea and vomiting. It does not come in contact with gastric substance. This means that the GI does not interfere with drug potency. 3. Drug can be administered by the patient, unlike IV or IM route. It can be administered by the patient, unlike IV or IM route. Disadvantages. Privacy problem. Privacy is needed in the application of vaginal or rectal medication. The patient that is receiving vaginal or rectal medication usually need privacy, because in African setting, exposing the vagina or the rectum is seen as, they are part of the body that are seen as private part. So most patients don't want to expose it. So privacy is mostly needed. Unlike oral drugs, which can be swallowed anywhere. You can swallow oral drug in the car. You can swallow oral drug at home or anywhere. Drug may be administered at anywhere like oral, may not be administered at anywhere like oral medication. Drugs have slower onset of action when compared with IV route. Ear medication. These are mostly in form of drops which are instilled into the ear to cure ear problems. The drug should be given at body temperature. Aseptic technique is highly considered if the eardrum is perforated or if there is wound in the ear. Advantages of ear medication. It is convenient. Drug can be applied at anywhere at any time. It can be applied by the patient, unlike IV or IM injection. Disadvantages. The patient may experience pain or irritation if ear is perforated when administering ear medication. Eye medication. Eye medication are in form of drops, ointment, which are instilled into the eye in such a way that the dropper does not come in contact with the eyelid. The drug is being instilled into the lower porch of the eye. The dropper is being instilled into the lower porch of the eye. This is the lower porch. It's mostly pressed like this, and the dropper is instilled based on the number of drop. You don't put it on the inside, but you allow, when you press like this, the eye usually make a porch. The red part of the down part of the eyelids. The advantages of eye medication. It is convenient. That's the drug can be applied anywhere. It doesn't even need privacy. It can be applied by the patient, unlike IV or IM injection. The disadvantages: patient may experience pain or irritation of the medication. The next one is inhalation medication. Drugs may be inhaled in form of gases. Some drugs are administered for bronchodilation effect, sedative effect. The next one we'll talk about is medication through the feeding tubes. Medication through feeding tubes. The medication through feeding tubes include nasogastric tube, gastrotomy tube. Nasogastric tube, that is an NG or nasogastric tube. The tube is passed through the nose into the stomach. Gastrostomic tube